Good evening, my name is Mr. Saavedra. I am the first affirmative speaker. Our topic tonight is euthanasia, and our major claim is terminally ill and suffering patients should have the right to physician-assisted suicide. To begin, I would like to do some definitions and start off my first claim, which is euthanasia is misdefined. Deborah Gardner, in an article titled Quality of Life and Death in the Nursing Economics Journal, she writes that physician-assisted suicide is defined as when a physician provides either equipment or medication or informs the patient of the most efficacious use of already available means for the purpose of assisting the patient to end his or her own life. Voluntary active euthanasia is defined as when, at the request of the patient, a physician administers a medication or treatment, the intent of which is to end the patient's life. Euthanasia is legally supported in different places around the world, including in the own United States, and currently it is legal in Oregon and Washington. As of 2012, there have been 8 other states that want to propose an end-of-life legislation. Deborah Gardner, once again in Equality and Life and Death, she writes how these 8 states legalizing euthanasia, they fall into 3 categories. The first one is the same one that Oregon and Washington has, which is death by dignity. The following states that want to follow that is Vermont, Hawaii, and Massachusetts. There are 3 other states who want to ban and outlaw death with dignity from being practiced, which is Idaho, Montana, and Wyoming. They want to legislate that to ban that literally. And end-of-life options notification, honoring patients' end-of-life designations, perhaps the broadest category, which is being followed in other states. So for my next claim, denying euthanasia decreases the quality of life. So some patients, a lot of patients are suffering from terminally ill diseases. Once again, Deborah Gardner writes in her article, Quality in Life and Death, that 1.5 million Americans who die of chronic illnesses each year, more than 70% are admitted to hospitals during the last 6 months of their lives. And it depends on whether or not these terminally ill diseases are being treated with euthanasia. Also, patients are suffering not only from terminally ill diseases, but they are also suffering from incapacitating diseases. One example is a man named Charlie. David Mueller, in his article, Physician-Assisted Death is Illegal in Most States, so my patient made another choice, in Health Affairs Journal. He writes about Charlie, how at this point in his 90s, Charlie had debilitating back and leg pain from several spinal stenosis, a condition that compresses spinal cord and nerves. It causes walking to be so unstable that he was prone to falls. Charlie had seen a long list of neurologists, surgeons, and spine specialists, none of whom have been able to relieve his pain. For the past 2 years, he'd been refusing all offers of medical care or help at home. And that's just one of many cases where there are patients who are suffering from other incapacitating diseases, not specifically terminally ill diseases. And these would really benefit from something like euthanasia. Which brings me to my next claim, which euthanasia will help out any sort of suffering patient. So if euthanasia would be legalized, then the law would redefine suicide into legal terms. Because currently, according to Washington versus Gloucester from 1997, Amy White writes in her article titled Refusal of Treatment, Suicide Intervention and Autonomy, she explains the Washington versus Gloucester case that Promoting suicide attempt is a felony punishable by up to 5 years imprisonment and $10,000 fine. This would be kind of unfair if you were trying to help out a patient who is suffering. Another reason why a legalized law would cease, legalizing euthanasia is because it would cease inhumane forms of suicide. Also, in Refusal of Treatment, Suicide and Intervention by Amy White, she writes the following: suicide clearly can incorporate passive as well as active means. This is obviously the case for those who commit suicide by refusing to eat or drink. Also, one can commit suicide by refusing treatment. The motives of a person who commits suicide by refusing treatment may differ very little from suicides utilizing other methods. And again, going back to the earlier case that I was talking about, the man named Charlie, he actually began starving himself, and he had starved himself for 2 weeks before he had finally passed away. Currently, one of the most famous organizations that assists people in dying is called Dignitas. It's located in Switzerland. The Dignitas organization is helping out members voluntarily die with dignity. According to their brochure, the following prerequisites have to be met in order to be part of the organization. They have to be a member of Dignitas, including paying fees and fines, be of sound judgment, which means they have to be mentally capacitated in order to be part of the organization, and possess a minimum level of physical mobility sufficient to self-administer the drug themselves. Also in the brochure, it says that because the cooperation of a Swiss medical doctor or physician is absolutely vital in obtaining the required drug, further prerequisites mean that the person must have a disease which will lead to death, terminal illness, and or an unendurable incapacitating disability, and or an unbearable and uncontrollable pain.